talk about helmet removal techniques, which mostly is going to be in the emergency department. Mostly we're going to talk to the ER docs tomorrow about this and see what questions they might have about the helmets and stuff. Because I remember when technology changes, you don't always see those things until they come in. And then we'll have some questions. So go ahead and you can tell them what you want about the helmet.
Yep. Most of our helmets here are newer. They have the Rydell quick release. It's just a little button in here, and I have a fancy tool to pop it, and just like that, it's out already. I don't have to fiddle around with trying to unscrew anything. Putting it back together, it takes a little bit.
Joe and I were talking earlier today that most of the helmets used to have just the screws on the tabs,
Yep.
and you'd be wrestling with those screws.
And this one, you don't have to go out and buy one of these. You got a ballpoint pen, pencil. That's their big thing, was you could do it with a pencil. To get it back in, though, you need the tool.
Are all the tabs quick release?
Yep, as far as I know, all of these tabs on the side of the helmets are quick release. So that makes it nice and easy. Someone goes down in a matter of seconds. I have access to their airway.
Now the tabs on the top?
Now the tabs on the top, those are a little more varied. These are the slightly older version where you have to unscrew them. There's a longer screw. I couldn't get my hands on one of the newer ones where it's basically either a quarter turn or a half turn, and it just kind of hooks into the helmet. And those are real quick and easy to get out. But these are the screws in, I'd say, a majority of them, where they're this kind of longer to pull off the helmet.
The guidelines address this, that they said that in the past it was recommended just reflect that face mask back, because trying to take it off would be difficult at times. Of course, all that extra movement. But now they recommended in this, and this is before the helmet changes, take it off completely, because the only reason you're taking it off is for access to airway.
Yep.
And you can see what you guys think about it, but having that reflected back might be pretty difficult if you're above the patient trying to look down. So the tools you would need then?
Pretty much ballpoint pen and screwdriver, regular. I think all of them are Phillips.
Could you say ballpoint pen, if you had a Phillips screwdriver, could you punch that out? So
Maybe, it depends on, I haven't tried to yet.
Maybe that tiny screwdriver you use to fix your glasses.
Yeah, exactly. It looks like it gets close, but it doesn't quite release on this. But I guess if you had a finer point on this one, this one's kind of run off.
Yes.
Pretty sure chance that you carry a pen over a screwdriver is.
Pen or a pencil.
Just
either way.
thinking that ease of
Yeah, you just.
only having one. Yeah.
I think
But if there was a need, I mean, you would recognize that, you would have probably the face mask off before.
Yep. Yeah, most likely I would.
When we had that case 2 weeks ago,
This
we had
helmet
that face mask off real fast because it was a quick release one.
Yep, and then we got the screws out
Yeah.
on the top.
The other thing, if you show them what you told me about the chin strap and how you're encouraging players to have.
I make sure that pretty much all of my guys have their chin strap going behind here instead of on top, because if it's on top, then you got to cut it another step. What's nice about the chin strap, if you can save it depending on how it's set up, is it'll also help hold the head in the helmet to give you better control and better stability in there. I make sure all of my guys do it. I can't vouch for anybody else though. There's no standard that says you should do this. This was kind of one of those things mentioned to me in passing. I went, well, yeah, that makes a lot of sense. So I just kind of encourage everyone I talk to do this, and I make all my football guys do it.